Have you exhausted all of your options and nothing is working? It can be tiring to work hard in order to feel better and try everything that others have suggested, but nothing appears to be working. This is a typical occurrence when you suffer from anxiety, sadness, or another mental health issue, and it's important to recognize that it isn't your fault if you aren't getting any better. When something is wrong with our mental health, it can be difficult to cope. If you are struggling and nothing seems to be working, don't give up. There are many resources available to guide you. Seek help from a professional, join a support group, or read self-help books. You can get through this tough time and improve your mental health. Don't give up, you deserve it. It can be difficult to find the right combination of treatments for our mental health. That's why we should always keep an open mind and try new things. You might just discover that what works best with one person doesn't work in another situation, which is why it is important not only to ask others about their experiences but also to experiment on yourself too. After all, self-experimentation has been shown time after again is effective. What to do next? Here are some ideas to explore. Common roadblocks to progress. I have tried many different strategies, but nothing is working for me. If you have been struggling with mental health issues and feel like there is no light at the end of your tunnel, do not hesitate any longer. Seek medical care right away before it's too late. There are many mental health issues that can't be fixed only by using self-help methods and require professional help, such as seeing a doctor or taking medication. If you haven't done so already, it may now seem like the right time to seek medical assistance for your condition, since there is no guarantee in this world of getting better without trying everything possible. Many mental health issues cannot be fixed by only using self-help methods and requiring professional help, such as seeing a doctor or taking medication. If you have not done so already, it is probably time to seek medical assistance. Psychology plays an important role in our mental health. It can help us understand our thoughts, feelings, and behavior. However, psychology is not always enough. Sometimes, we need medical help to manage our mental health. This is where doctors come in. Doctors can help us understand our mental health issues and develop a plan to treat them. They can also prescribe medication to help us cope with our symptoms. If you have not seen a doctor for your mental health issues, it may be time to seek medical assistance. I sought out professional help, but it was to no avail. The unfortunate reality is that many professionals in the medical and mental health field don't understand what their patients are going through. It's also important to remember, though, what works for one person may not work for another. So if you're unhappy with your current situation, know there's always someone out there who could be better suited. I'm sure they'll find somebody soon enough themselves, or at least breathe me. There are plenty of great options out there. I'm sick and tired of trying, and I'm ready to give up. You may believe you don't have the energy to continue seeking assistance and attempting to improve, but don't give up yet. A little patience and one more stride might be all it takes. You've already come quite a way, why not try again? Build a supportive network by finding someone to help you with your next steps and getting help. It can make a big difference to have someone who encourages you, reminds you to keep trying, and holds you accountable for doing your therapy. Homework, refilling prescriptions, and meditating regularly. Once you've found your support person, it's time to build your dream team for success. Choosing the best approach for you. Finding the right people. Finding the appropriate doctor and therapist is critical to a successful recovery. It's similar to dating. You may have to try a few doctors before finding one you trust and feel safe with. One of the most important factors in determining treatment success is the patient's relationship with their mental health practitioner. Therefore, you should feel comfortable discussing your problems with him or her. You may also want someone who has a similar background, sexual orientation, gender, or other life experiences to you. Alternatively, you might choose someone with a dramatically different experience from yours who can offer something new. The most effective therapy option is the one that is most suitable for you. Sometimes we need to try different forms of treatment until the right one works for us. If your psychologist is not giving you results, don't be afraid to stop being honest and discuss trying a new type of approach with them. Sometimes it can seem hard talking about our needs, but honesty will help in healing from long-term mental health difficulties, so make sure that both yourself as well as your doctor know what's best suited to helping those symptoms too. The ideal combination. We understand that self-help methods are usually not enough, and this is also the case for therapy and medication. Therefore, it's best to opt for a combination of psychological therapy, lifestyle changes, and medication to treat long-term mental health issues. This is why having a team effort is key, so we can figure out what works specifically for you. Psychology plays an important role in our understanding of mental health and how to treat long-term mental health issues. Psychology teaches us about the importance of a team effort in order to figure out what works specifically for the individual. Medical help is essential in order to understand the underlying causes of mental health issues and to develop an effective treatment plan. However, medical help is not enough. Lifestyle changes, such as exercise, diet, and social support, are also important for treating mental health issues. Exercise has been shown to be beneficial for treating depression and anxiety. Your diet can also affect your mental health. For example, omega-3 fatty acids have been shown to help relieve symptoms of depression. Social support is another important factor in treating mental health issues. This social support can come from family, friends, or even a support group. Having a team effort is key to figuring out what works specifically for you and your needs. Eager to change things up? Try new approaches or various combinations of old techniques at different times. Give it some time. Some medications and therapies can take weeks or even months to show any effects. For example, people usually have to wait 4 to 6 weeks after starting antidepressant medication before they begin feeling less depressed, and it may take up to 12 weeks for other mental health difficulties, such as OCD, to start improving. Most psychological therapy programs last anywhere from 8 to 20 sessions, though some may go on longer depending on the complexity of your condition. If you're unsure how long treatment will take, ask your clinician for an estimate. If you're working hard to improve yet don't feel any better, remember that it's not your fault. If you want to get well, you'll need specialized therapy if you haven't received it already. It may be time to try something new if what you've been doing hasn't worked. Seek a second viewpoint, pursue a different therapy approach, switch to a new therapist or GP, or request a medication change. Psychology is the branch of science that focuses on the study of human mental faculties and behaviors. It is a relatively young science, but it has already made a great impact on our understanding of ourselves and our societies. Psychology has helped us to understand the importance of mental health, and it has also shown us that mental health problems are very common. In fact, 1 in 4 people will have a mental illness at some point during their life. The field of psychology has also informed us that mental health issues are not always due to traumatic events or faulty genes. Sometimes, they can be caused by medical conditions. For example, depression can be caused by an imbalance of certain chemicals in the brain. Psychology has also helped us to understand that mental health problems are not always permanent. With the right treatment, many people with mental health problems can recover and live full and happy lives. So, if you are experiencing a mental health problem, remember that you are not alone. There is help available, and there is hope. Never give up. Remember that you are the expert on yourself. If something's not working for you or you'd like to try a different approach, speak up. With the right support system and treatment plan, anyone can learn how to cope with mental health issues and feel better.